All right. Hello, everybody. Thank you for taking the time to be part of the Pemberton County Memorial Hospital and Pemberton County Public Health Community Health Needs Assessment. While we normally like to present this information in person, so we are able to interact and ask and answer questions, we are being kept from that, obviously, from the pandemic. So we're not able to come out to the community until due to social distancing, and our deadline is nearing. So we want to help to get through that. So it's unfortunate that we weren't able to make it out. It's one of our favorite parts of our job to come out and speak with the community and kind of gain a little more, a little better relationship, I think, with the people, with the residents. All right. So today we're going to present to you the findings from the key informant interviews that we conducted, the online and paper survey, and secondary data. After you listen to the presentation, we're going to give you a brief survey. It's just about 3 or 4 questions. It's an online survey that will allow us to gather your top 4 concerns. All right, now nonprofit hospitals, a little bit about why assess community health. Nonprofit hospitals are required to conduct a community health needs assessment every 3 years in collaboration with public health. It's an opportunity for the health organizations in the area to take stock of the community assets and challenges in a way that has community buy-in because they're providing direct input. And since this is done every 3 years, it's an opportunity to benchmark and track changes and progress through the years. Now, of course, the assessment is required to be conducted every 3 years, but don't let the requirement get in the way of how useful this process is for the community in identifying those concerns. So the Center for Rural Health over here where we are in Grand Forks, we conduct CHNAs for over 86% of North Dakota critical access hospitals. Throughout the process, we utilize the same assessment method, so we are able to aggregate our findings to present to policymakers to help improve the health of communities at the local and state level. It also means or provides a means to share findings amongst various communities so that ideas can be shared. So this right here is one of the features of the Center for Rural Health CHNA website. You can see the map here, and you can see which communities are conducting their CHNAs collaboratively with public health, which are the orange icons with the multiple people, which are conducting it mostly independently with limited assistance from public health, and those are just the blue hospital icons. The public health units that have completed their own CHNAs, which are generally done as part of their accreditation, and accredited public health units must complete that every 5 years. Those are the little public health logos, and the green H's show the locations of the tertiary hospitals. So on that same webpage, if you look on the map, there's a listing of all the towns shown with various icons. But you may select up to 3 communities at a time. And this allows you to see what the top priorities are for the community or communities that you selected were in their last CHNA cycle. So if you go to another page on the CHNA website, you can see the priorities listed and then a listing of all the communities that selected those as the top priorities. Another page on the site provides the past 2 reports and implementation plans for each facility. I want to take a moment just to recognize that it isn't just healthcare that determines the health of a community. There are different models that kind of go over this, and here are a couple of those. Social determinants of health is a relatively recent term. So you can see healthcare includes such things as insurance coverage and access to care contributes to about 20% of your health outcomes. Your physical environment, or your neighborhood, is about 10%. That includes housing, transportation, and safety. Social and economic factors, the biggest one, encompass roughly about 40% when it comes to determining health outcomes. Some models of social determinants of health have these 2 as separate factors. Economic factors include things like employment, income, and expenses. And social factors are more of community engagement, discrimination, stress. And finally, health behaviors encompass the remaining 30%. It's important to separate that from health care. Behaviors are things such as healthy food selection, substance use, and unprotected sex all fall into this category. And keep in mind, like I said previously, there are a number of different social determinants of health, And while they're all relatively similar, some of them slightly vary with the numbers, but you get a good gauge for overall for what the number is. You can get a good average. Here's an example of another model that breaks them into 6 categories that determine health outcomes. We won't go through all of those right now, but it lists different examples under each category to give you an idea of what items fall into those. All right, so the next data we're going to take a look at is secondary data. This is information that is gathered from other sources, generally national groups. We pulled together. The Robert Wood Johnson Foundation out of Wisconsin Population Health Institute creates the county health rankings, which are extremely helpful for these, and those are created on an annual basis. They illustrate the community health needs and provide guidance for actions to improve health. So it's kind of a broad overview almost of a CHNA in a way. It compares each county to average state rates and the rates of the top 10% of counties in the nation on numerous topics. The handout that is attached to the email that you were sent with the link to this presentation includes secondary data for Pembina County. On page 1 are the county health rankings. The measures with the red dot mean that the country is performing worse than the state average, and the measures with the blue square mean that Pembina County is not meeting the top 10% nationally. And you might see some plus signs in there right here, which means they're doing better than the top 10% nationally. So right now, Pembina County is doing better than the top 10% in low rates of poor physical and mental health days, and you can see that those are within the past 30 days. Children in single-parent households, severe housing problems such as overcrowding and lack of facilities, but they have a much higher rate of social associations, which of course is a good thing, than the top 10% of national counties, which is fantastic. And that's usually kind of rings true for most rural communities, and we'll get to see in some of the responses of how communities generally come together and are quick to identify that. Here's some areas where Pembina County is not meeting the state average. Premature deaths, low birth weight, food environment index, physical inactivity. These are in no particular order, of course. And I'll allow you to run down those. And of course, the attached PDF will give you a little more information on to take a look at it. But it's good to look at these in the context of the information that we are also providing and see if there's some sort of correlations there. When it comes to children's health needs, we look to kidscount.org to provide county-specific data. And these are the areas that Pembina County, is performing poorly compared to the North Dakota average. So again, a short list here. Rate of uninsured children is 2% higher than the state average, so not too much higher. Rate of uninsured children below 200% poverty, almost 3% higher than the state average. Rate of Medicaid recipients, just over 9% higher than state average. These are, of course, all compared to the state average, if you haven't noticed that by now. Healthy Steps a little higher, 19.9% less licensed childcare capacity than state average. These are kind of things, and you're going to see it throughout a lot of rural communities. If you read through other rural communities' reports or their findings, which are available on our website, you're going to see that a lot of rural communities have these same issues. That's why it's also important that we note collaboration with other communities in areas, especially when we look at that map. You're able to select your community and other communities that you can kind of compare them and see who has some of the same issues. And then we definitely encourage that kind of networking or reaching out to others to see maybe how they've done theirs and to maybe copy a model or take somebody else's model and kind of make it your own. Okay, let's get into the surveys. First of all, we're going to get started on demographics, a little bit of demographics. We had a total of 75 community members respond, 8 paper, 67 online. I would like to say, just because of the pandemic, we probably had a slightly lower participation with paper. But I don't want that to that doesn't really tell the whole story, because we are seeing a decline in returned paper copies overall. People are heavily focused online, of course, so it's great to keep in mind for future assessments. it's important when promoting to keep that in mind. Of course, you have that demographic that strictly stays to things like, the physical copies in general. So not going away yet, probably never will go away completely. But there it is, just for your information. All right, let's take a look at the zip codes after my rambling here. So heavily, the amount of people lived in Cavalier, following a couple, of course, Walhalla and Pembina, and then the other surrounding communities. So where most of the people were that were taking the survey. All right, let's get started with some more demographics. Females generally, or women generally, tend to heavily outweigh men when it comes to this survey. Don't know what it is. Great participation from them, though. Thank you. You might notice that these add up to 50 responses total, and we had 75 people or respondents for the survey. Not everybody answers all of the questions, and you're going to see some of these questions, of course. Coming up soon, you're going to see some of the survey responses, rather, that allow more than one response. So you're going to see a lot more numbers, but there were 75 overall total, just to keep it in line. So yeah, guys, step it up. Here we go. So age, this is a little different than a lot of other communities. Traditionally, you see these 55 and older crowd kind of dominate the survey as survey respondents. Here we have the 35 to 44 years getting heavily involved, and then 45 to 54 years, great. And 25 to 34 years is in an age group that you see a ton of involvement. So they're all pretty strong. All of them, in fact, outdid the 75 years and older, which we generally have a decent response rate from. 18 to 24, still nothing there. We'll get those younger ones in there sometimes, I'm sure. Less than 18 years, we do not survey anyone under 18. So if we receive any survey respondents, any paper or online copies from minors, we do not accept them. We do not tally that data. Education, bachelor's degree by far the highest, associate's degree coming in there in second, and then some college. So there's a lot of college going around. You have six people with high school diploma or GED, but everybody beyond that, you had almost everybody had some sort of higher education, and 0% or less than high school. And employment, we had 51 total responses on this. So full-time, again, heavily outweighs everything. And then you jump down to retired. These are generally the top two for most communities, followed by part-time and, of course, homemaker. And then you have the one multiple job holder. Insurance coverage, heavily through your employer, 79%. Medicare following behind, or right behind that. And self-purchase insurance, of course. Again, this is one of those ones you can see one of our little notations down there at the bottom that people were allowed to select more than one service, or more than one. More than one service. So the numbers are going to be a little different than what you might be expecting. The two other options that were chosen didn't identify anything specific. They just put other. So we're not sure what those two were. Income level, 100,000 to 150,000. Top percent. I kind of want to, I like to make a note of this, and this is something that I've personally noticed trending is you're seeing within these a lot of communities reporting back that they're making decent money. Six figures is generally on top, or the 75,000 and 99,000 is pretty close there. The main reason I do this is because look, there were only 3 people that had 15,000 to 25,000, no respondents less than 15,000. And then of course only 6 respondents from 25 to 50,000, which you would think would be a pretty popular demographic. Again, I can't point to what the reason is specifically for this. You can kind of assume that these people don't have insurance or have limited insurance, aren't really involved in healthcare in the community, don't really know what's going on. Maybe the survey didn't get to them, or they just didn't have time. I just want to say it's important to note that you're not seeing as big of a voice. You're not seeing that voice of the more lower income people or residents, it's not really representative. You're seeing a lot in the higher ends. Can anything be done about that? I don't know. It might come down to promotion of the survey to certain groups of people. But I just like to make a note of it because that's the voice you're hearing is the more well-off individuals from the community, and then you're getting down to here. That's not to say that it shouldn't undermine their opinions, of course, but you will see different issues between those two demographics. All right, so let's move on to some things that I'm really happy about doing. I'm always like reaching out with the key informants. Normally we would have a community group meeting. We did not this time because of the pandemic. So we just bumped up our key informant interview. So I got in touch with a lot of you, and I probably could have filled 3 or 4 slides, honestly, for this one. We like to keep it to 1 because I don't want to take too much of your time. But these are some of the things that we find in rural communities. These are some of the reasons that we choose to live in rural communities: sense of peace and safety, the school systems, low crime rate, the land, the connections with others in the community. Like I mentioned, social associations earlier being much higher for Pembina County than the general, than the national numbers. There's the connectedness among community members in rural communities that you just don't get in urban areas, or you don't. It's hard to find. You might find your small groups, but it's nothing like this. So don't take 1 slide or 3/4 of a slide being populated as there's little or not enough. There were a ton. I just wanted to give you a few, let you know that how people feel about the community. So that's great. So about the people, on that note, we asked people what the 3 best things were in the area. People are friendly, helpful, and supportive right at the bat. Top 1, you can see the top 3 right there. People living here involved, and you feel connected to the people. And there's kind of a drop off, obviously. Government is accessible. People are inclusive and open-minded. Sure, maybe there are some things that could be changed here and there. But it's great that people have these feelings towards the community and towards the people. All right, best things about the quality of life. Again, you're kind of going back to what the key informant said. I want to specify that these are from the survey, not the key. These are not the key informant answers that we just went over. Those bulleted lists. Safe place to live, family friendly, informal, laid back lifestyle. We're going to get to services and resources, which might be a little different. It's a little more specific than the best things about the community, just asking the best things about the community. But healthcare right on top, fantastic. I think it's great. Definitely a lot of people report the relationship that they're able to build with the staff with healthcare staff in their community. That's fantastic. It's always great to see as the #1 response. An active faith community, fantastic. Churches are always out there and collaborating, engaging in these communities. People speak very highly of those, of course. And quality school systems. Top 3 right there. You can go down the list and see some of the smaller, or some of what got some of the least answers or least responses. So community activities, local and events and festivals are #1. Recreational sports and activities, fantastic. A lot of good land in North Dakota to be able to get out and do some things. And activities for family and youth. Year-round access to fitness opportunities. It's tough because a lot of rural communities have one or none for fitness centers. And of course, it's going to be difficult for a lot of people to get out and run in, -15 weather. I know we all like to do that, but sometimes we just aren't able to get to it. So we asked key informants to basically give us the collaboration and community engagement, or rate the collaboration and community engagement of various organizations within the community on a scale of 1 to 5. Most, if not all of you, are key informants listening to this, so you remember this part. It was really fun. We got to have some fun little ratings. Of course, I just want to mention this or put a reminder in there that, as in the interviews, this isn't about their ability to perform their services. It's how involved they are in the community, how willing they are to work with others. Did they play well with others? So first thing I'm going to say, with a 1 through 5, 2.5 is average, and every entity on this was above 2.5, which is fantastic. In fact, they were all above 3. The lowest one, Human Services Agency, 3.25. but the top really give you a good look at what the strengths are in the area. And it, again, you're going to go back to the best things about the people, the best things about the services, and then the key informant about the key informant question about what's the best things in your community. Emergency services. I've only ever heard one thing in all the rural communities that I've worked in. What I hear about emergency services, they're always fantastic. They're always filled with great people. They just need more staffing. So it's great that they're being recognized. Everybody loves them. Faith-based, again, we saw that earlier in some of the services that were available. Hospital healthcare system, 4.5. Law enforcement, 4.5. We're just going down the list, 4.5s. Business and industry, 4.25, and pharmacy at 4. And then, of course, the other clinics at a 4. All above a 4. These are all really good ratings. Fantastic numbers overall. It's great to see. All right, now we are getting down to the community concerns as identified by the key informant interview. So you all gave me your answers. We all talked on the phone and we went over these. This was one of the more difficult areas because it's all about picking just those top 3, and then we kind of round them out. But here we go. Yeah, attracting, entertaining young families for community environmental health, not enough affordable housing, child daycare services, and physical violence, domestic violence, and sexual abuse. Availability, delivery of health services concerns, availability of mental health services on the rise throughout North Dakota, on the rise throughout the nation, probably globally. Availability of specialists, substance use disorder treatment services, and cost of health insurance, which of course another big one for all rural areas. So youth population health concerns: alcohol use and abuse, depression, anxiety, suicide, and stress. Fairly common, what we see throughout rural communities. Adult population health concerns somewhat mirror that with stress, alcohol and abuse, and depression and anxiety. I think it's important to note that since adults were the only ones taking this survey, they picked depression and anxiety as number 1 for adults, but it was second for youth population health concerns. And we know, of course, sometimes that depression and anxiety can lead to substance abuse, and of course sometimes substance abuse leads to depression and anxiety. But it's interesting to note that adults picked alcohol use and abuse as the first one for youth, which is sometimes more of a symptom, and depression and anxiety is number 1 for adults. Alcohol use and abuse is second. So just something to look at. Again, these are just little things that I kind of noticed throughout them. Do they mean anything necessarily? No. Sometimes they're just little side notes. You do with that information what you will. And moving on to senior population health concerns. Cost of long-term nursing home care. That is typically a big one. Availability of resources to help them stay in their homes. Availability of activities for seniors, and generally being able to meet the needs of the older population. So nothing new that we are seeing here, but it gives you a good jumping point. And then we'll get to what the survey respondents felt were the most important in just a little bit. Right now, we're going to go over the general concern questions that we asked on the survey. Keep in mind, of course, these are specific to the survey or exclusive to the survey and not the key informant interviews. But it's important to go back and reference the key informant interview responses or concerns. So attracting and retaining young families, number 1 off there. Not enough jobs with livable wages, somewhat close second there, and enough quality school resources. I think that's a pretty pressing one. It's third, and it's not nearly as high number-wise as the top 2, but that's kind of a base right there is enough quality school resources, and it not always doesn't make the top 3, so it's something to take a look at on those. Bullying and not enough affordable housing, of course, coming in right down there. We saw not enough affordable housing, as well as some of the others with the key informants. Okay, so concerns about availability and delivery of health services. It's a little crunch. There's a lot of information here. I hope you can read it all, but like I said, we'll have the PDF out to do that. Availability of vision care was mentioned frequently throughout the interviews. Number 1 here, availability of mental health services, which was not only mentioned frequently throughout our interviews, it's mentioned frequently throughout all of our meetings and interviews when it comes to rural areas. You have quite a drop off on cost of health insurance, but of course it's is still quite a large concern in everywhere. Not comfortable seeking care, where I know the employees on staff. I mean, that happens a lot. It's kind of a double-edged sword. And I got to talk with, of course, during our interviews, they would say the same thing. It's a good thing and a bad thing. On one hand, you build that relationship with somebody and you know them and you feel comfortable talking to them about issues. On the other hand, you don't want to run into somebody who knows all these things about you at the grocery store. You might want to keep that private. So that was kind of a response that we saw, on that works both ways. Availability of specialists kind of jumping down there too. Some of the other responses that were put forth were a need for a pediatrician, need for another pharmacy, and dialysis. So jump into the youth population concerns. Again, we have pretty much the substance abuse things are at the top. We have smoking and tobacco, or vaping and juuling right on top there. Alcohol, followed by alcohol abuse, drug use abuse, and then depression. And again, I think it's important to note that sometimes substance abuse is a symptom of depression or behavioral health issues. But of course, I won't go quite into that. I'll give you the info here. We got the suicide shortly after that, which was a little bit higher than in some counties. Not enough activities for children, and then you kind of see more of a drop off there for obesity and overweight, and no other responses for this one. Adult population concerns, depression was number one, just like the key informants, and obesity and overweight was number two. And these kind of have a strong little hold over the rest of the list. Alcohol use and abuse, the third, and stress down there at four, which sometimes go hand in hand with depression and anxiety. And again, alcohol use and abuse, and then drug use and abuse, which gets down to there, which is number five. Not getting enough exercise, of course, kind of ties into obesity and overweight. A lot more responses for concerns over cancer than a lot of other communities. And I'll let you look over the rest on those as we go through. Senior populations concerns, availability of resources to help the elderly stay in their homes, cost of long-term nursing home care, assisted living options, availability of resources for individuals caring for elders. These are, again, we see the same things in the key informant interviews, so we know that the community is seeing some of the same things, so we know that these are issues. Violence concerns, bullying and cyberbullying is pretty much always number one for these surveys, for the violence concerns responses anyways. Child abuse and neglect drops down, as for number two, significantly, but it's still there, and it's still a problem if 38% of people are choosing that. Same with domestic and intimate partner violence, fairly high. Media violence, and then general violence against women, of course, at 10%, 10% too high. All of these, of course, are too high. So something to take a look at. Okay, barriers to receiving care, where we asked everybody if they could give us whether mental or physical, reasons that people don't seek out care. It could be, of course, self-imposed, or it could be outside restrictions, but just ways that people aren't receiving care. So no insurance or limited insurance. Number one, which is usually number one, not enough evening or weekend hours. A lot of people clamor for, bumped up hours on the after hours, later in the day, or maybe an hour earlier, and then a few weekend hours so they can get their times in. Not enough specialists, and of course we know how difficult that getting specialists sometimes to a rural community is. If it's not going to be widely enough used to balance out the cost of bringing a specialist in, then it's going to be difficult to continue to bring them in. But of course, most places do bring in specialists on a rotational period, kind of on once a month type of thing. And concerns about confidentiality and health care not being affordable, which kind of goes hand in hand with no insurance or limited insurance. Sources of trusted health information, primary care provider, number one at 91%, fantastic. That's where I would hope that everybody would go for their for health information, or other healthcare professionals. Fantastic, great, good job, going to the right people. Web searches, internet. I think it's a good jumping off point, sometimes, but I think we have all seen how that goes, where your finger kind of hurts and you go to WebMD and look it up and you possibly have cancer. So yeah, a good place to kind of get info, I guess. But yes, primary care provider and other health professionals are probably the best. I would put public health professional probably right there with healthcare professionals. And I'm actually surprised that people aren't utilizing public health a little more for trusted health information, because they're there. I mean, they're there, and they offer some you can offer some invaluable assistance. So we asked an open-ended question of which healthcare services people would like to add locally. Dialysis being number one. Vision we saw earlier, so that's number two right there. Homeopathic, naturopathic treatments. In-home flu shots for the elderly, mental health services, mentioned several times, psychology mentioned several times, which could also lead into mental health services. Weight loss treatment, we saw a little bit of obesity issues with the adults, and as far as the responses go. We asked people what their awareness of Pembina County Memorial Hospital services was. Great response, I think, here. You mostly 90s, 80s, and 70s. You drop down a little bit with some of the social services and arthritis treatment, speech therapy. And I think those are great things to continue to promote. I know social services sometimes can help with a lot of areas that people don't recognize they do. That could be built back up, but generally people are pretty aware of the services that are available at the hospital, which is great. You're getting the word out. People know what's going on. Awareness of services by other providers. Dental services sits squarely on top. Chiropractic services not too far behind. An ambulance not too far behind that. Massage therapy drops off a little more, and then optometric or vision services dead last right there. Of course, that's becoming a theme along with several other areas that vision services or lack thereof are becoming a problem. Awareness of services offered by all true specialty care. Generally a decent knowledge. Speech therapy right there, and health screenings top two. Social services good, a little higher than earlier, and it just kind of tapers off from that down to occupational therapy. And awareness of Pembina County public health services. Immunizations right at the top, which is fairly common. Car seat program, again, great tool and fairly well known throughout communities. School health, fantastic that a lot of people are aware of their involvement in school health. Tobacco and prevention control, again, great resource for tobacco and prevention control, public health units. And tuberculosis testing and management being at the bottom right there. So we asked awareness of the support groups that are in the community, and AA was mentioned a couple times. Also, there were Alzheimer's groups and domestic violence groups and some dementia care providers and faith in action. And these were, of course, open-ended questions, these next two. When we go to support groups to add, I put the question mark behind Alcoholics Anonymous because several people said that they were aware of the group, and then several people said that they would like to add it. So I'm assuming that it's likely in the area and these people did not know it was there. But I think it's important to note that several people specifically mentioned that they would like to add it. So if it's there and they don't know, I mean, it would be a great thing to get promoted. Mental health groups, of course, it's becoming such an increasing issue or identified issue. It's mental health, I think, has been an issue for years and years and years, decades and centuries. And it's just now, starting to be more identified, and the stigma is starting to go away with it. So great addition to something right there. Grief support and suicide prevention. We noted earlier in youth concerns that suicide was a little higher than normal on there. So good things to look at. So we asked another open-ended question, biggest challenge facing the community. The two categories that emerged above all else lack of jobs with livable wages, and decreasing population businesses. I put those two together. Generally, there was a large cry out for about the decreasing population. There was a big response choosing decreasing population, but there was about the same amount of responses choosing the decreasing businesses. And of course, those are going to go hand in hand. If the population decreases, businesses are going to get hit from that inability to stay open. And so as people leave and the population ages and young families aren't brought in or increasing that are staying there, you're going to see things like that. So some of the other biggest challenges that were identified: substance use and abuse, and of course we've seen these. We're seeing these in key informant interviews and the tops of the survey concerns. Community not working together for a common goal. That's a new one. That's a fairly new one. I would like to point out that there were a lot of people that said the community works well together. And this is just one response. So it's not to say that it's not to be looked at, but it could be looked at as an outlier because you had so many responses saying the community works well together. But it's important to note everyone's voice. Feeding young children, lack of mental health care, there we see that again, and lack of specialty doctors. So needs that emerged from the data. So basically what we did is we took all the information and we just prioritized the following needs. So you'll be able to kind of guide you along in how these are going to be addressed. Not all of them have 4. Some of them have 5 because they were tied. And you'll see those in the final survey when we ask for your concerns, so we can start to begin to prioritize. So here were the top 4 concerns for each group. You had community environmental health concerns, attracting and entertaining young families, not enough jobs with livable wages, having enough quality school resources, bullying and cyberbullying, and not enough affordable housing. Availability of vision care, there it is, popping up again. Availability of mental health services, health insurance, youth population, it's depression and anxiety, and then mostly substance abuse. Adult population, depression, anxiety, of course, and there we see obesity again, alcohol use and abuse, and drug use and abuse, and stress added on there too, of course. Availability of resources to help elderly stay in their homes, assisted living options, cost of nursing home care. These are, and we're pretty much retreading some of the old information that we've seen. These are areas that we've previously identified and highly identified. So these are your top concerns for the community. So what do we do now? Well, we just presented our findings. So now it's time for you to tell us what you feel the top priorities are. So in the PDF or in the email, we will have a link in both. You'll have a link to click for a Qualtrics survey. And we're going to call this survey part 1. And we're going to call it meeting 2 part 1. And we'll have you select the 4 biggest concerns that you have. The concerns you'll be selecting from are the top concerns that were listed for the survey results in key informant interviews. Most of the top issues overlap, so there are around 4 topics from each category. But you aren't picking from each category. They're all bunched together, and you will pick your overall top 4 concerns. Now, we ask that you complete that by 5 p.m. on October 5th. That's next Monday afternoon. Please do not select more than 4 options. You won't be allowed. Don't try. And then after you take the results, this will be sent to you by email, of course, should be sent to you by email. You can either use that link or the link that is in the PDF to just click on and go straight there. And we ask that you fill those out by Monday at 5 p.m. We're going to analyze the results from that, and then we're going to make a second survey. And that survey is going to have you pick your one top issue. We're going to whittle out all the top issues from that first survey, and we're going to give you a selection of about 4 that you'll be emailed to, and that'll be a shorter survey than the first one, which was already pretty short. and then we'll figure out the top issue. And from there, we'll be able to rank those, and then we'll be able to put them in the report, and then we'll be able to pass that on. So the deadline to complete that is going to be noon on October 12th. So the week after the first survey. And we'll get you the survey we'll get you the link to the second survey the day after. So on October 6th, we're going to get you that survey, the second survey to identify your top one. Okay, so now I'm just going to go and ask you to complete that survey. You know, it's in the email, it's in the PDF. If you have any questions, you can reach out to Anne at the hospital. You can reach out to me. I have my contact information right there. So again, thank you so much for taking part in this survey and this assessment. We appreciate it. Again, coming out to your community is one of the best parts of our job, and I'm sad we're not able to do it. But we're still going to get this done. We're going to figure out what the issues are. We're going to prioritize them, and then we're going to get a plan together to take care of that. So thank you so much. Go out and get those surveys done, and I look forward to hearing from you. Thank you.